Doesn't that music make you want to dance?
Yeah.
It feels like a 1920s movie or something. Charlie Chaplin, right? Anyway, welcome everyone to Highways Performance Space and Gallery. Yes, I love this space. Highways is in its 36th year of developing and presenting new performance works. And we work with artists who deal with political, social, psychological, and personal narratives. And for the last 36 years, we've continued to develop the new works, and we're very happy to have John Melpeet here, who was, come on up, John, who was one of the first artists on this stage 36 years ago.
So I just wanted to say that this, you know, with the homeless crisis going on for the last 36 years or more, you know, sometimes it seems like things are hopeless, but this work is inspired by the innovative and profound work of a lot of people in the service providers and healthcare providers. And it builds on discoveries that were made during the pandemic and other practices that are really, really beautiful and profound. And so after the performance, we have three people that are engaged in this work who are going to be talking about it on the panel, reimagining the future of healthcare for the homeless community. So we're going to do the performance, and then we can get right into the panel. So stick around. It'll be like 2 or 3 minutes while we redo. Meanwhile, I got to go put on my white coat. Okay. So we're all right there.
This performance is about the homelessness crisis and the link between healthcare and housing. It imagines the compassionate systems that need to be created, and it builds on the practices that evolved at the quarantine and isolation medical sites created by the Los Angeles County Department of Health Services during the pandemic. These practices, invented on the fly by frontline workers, have catalyzed new initiatives that work.
Never let a good crisis go to waste. Winston Churchill said that.
Crises create opportunity. Dr. Jennifer Sudarsky of the QI Medical Sites said that in 2021 and 2022.
When things break down, opportunity abounds.
When things are broke, don't fix them. Invent something better.
Better ways of providing health care.
Leverage the homeless.
And leads to housing.
When you're feeling sick, you don't need to be out on the street. When you're feeling sick, you don't need to be out on the street. Out on the street. Out on the street. Out on the street. When you're feeling sick, you don't need to be out on the street.
You don't need to be
When you're feeling sick, you don't need to be out on the street.
out on the street.
Out on the street. When you're feeling sick, you don't need to be out on the street.
It was crazy.
It was a hotel turned into a hospital.
With hundreds of people in and out.
patients, ambulance drivers,
CNAs.
People who are doing social service.
People who are getting the calls.
And deportants, right?
The cleaning crew.
People bringing in the food.
And the supplies to make it run.
It went from nothing one day to a working hospital the next day.
incredible.
Incredible!
Incredible.
Incredible.
Incredible!
Incredible.
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 Incredible!
Do, re, mi, fa, sol, do, re, mi, fa, sol. When you're feeling sick,
You don't need to be out on the street. When you're feeling sick, you don't need to be out on the street. When you're feeling sick, you don't need to be
Sick.
out on the street. When you're feeling sick, you don't need to be out on the street.
You don't need to be
When you're feeling sick, you don't need to be
sick
out on the street.
out on the street.
Out on the street.
When you're feeling sick,
You don't need to be out on the street.
We did an early morning huddle to exchange notes with the night shift. And 30 minutes after the huddle, I went to see one of my patients.
Your patient's condition can change at any time.
I went to see him and I couldn't get an answer. The MAs went to check his vitals and they couldn't get an answer.
That patient didn't come in with a lot of symptoms, but he was COVID positive.
You know, about 30 minutes after that, they all came running in. Somebody's got to come in now. I went to my patient's room, and he had expired.
We've lost a few in the centers. But that was the only patient of mine that died.
The holidays were terrible. I had to beg our staff to come in on Christmas. Christmas morning, we had very little staff.
So I told staff as they came in, we're screwed. I'm sorry. It's gonna be terrible. You're gonna have 30 patients. But I'll be there with you. We'll do it together and we'll get through. And they were willing.
Then, as I was trying to get the assignments together, Dr. Emily walked in, and she brought nurses with her. Dr. Heidi came in too. They came in with staff. It brought tears to my eyes. I felt, this is a Christmas blessing beyond belief.
That was a really, really, really good day. Although it was a hard day. But it was a really, really good day because everyone stepped in.
There was this homeless man who lived in my neighborhood. He got admitted to this program and he was blind. We cared for his health and got him connected to some tiny homes. He's scheduled for his second eye surgery on Monday. His vision is going to be totally restored. And we got him connected to some asbestos services, and he's going to have a whole new lease on life. And it would not have been possible without this program. It's not a COVID Pacific, but it do speaks the value of this program. So I want to say thank you all for helping take care of my friend.
Thank you for helping take care of my friend and restoring his life. Thank you for helping take care of my friend and restoring his life. Restoring his life. Restoring his life. I want to say thank you for helping take care of my friend and take care of my friend. Thank you. Oh, thank you. Oh, thank you. Oh, thank you. Restoring his life. I can't be present for that. I can't be present for that. I can't be present for that. She is a patient, and she needs love and support.
I shall do.
She's a patient, and she needs love and support. I want to make sure that she's safe. It's two patients, since there's a baby. I wasn't there to judge her. I was there to help her be safe. And I was able to sit with her while she used and have compassion. And she felt loved and cared for. She knows that she doesn't want to be doing that. But do not judge her, shame her, really. And instead help her. It was a huge step for her. And for many other patients that we saw. I had a pregnant patient. She was on methamphetamine. We moved her to a program. But in the midst of the quarantine, she got her hands on some drugs. You know what she told me? She didn't want to be off of methamphetamine. She wanted to use drugs. I had drew close to her. And I would have thought in the past, I couldn't be present for this. I just couldn't be present for this. But we did it. We did it. We did it. We did it.
As the vaccines rolled out, we were less concerned about our patients dying because we were able to focus on the entire person.
The mental health services.
And medicine
Nursing,
and case management
Case management.
and more mental health services.
and more medicine,
And more nursing.
all under the same roof.
Under the same roof, under the same roof, under the same roof. It took a pandemic to do that.
It took a pandemic to do that. And I don't know if we are ever going to be able to experience that type of emotions again.
Hopefully not.
I am a physician. This changed the way I show up for work, the way I do my work, the way I think of work. I am a physician. This changed the way I show up for work.
I show up for work the way I do my work.
I'm a mental health clinician, and I've been in the mental health field for about 35 years. This is a site that is like no other site. In all my 35 years, I have never worked at a site like this. I've worked at clinics, I've worked for full-service partnerships, I've worked in state hospitals, I've worked in subacute hospitals. I have never worked at a site like this that managed to have all the different kinds of services in one place in a short amount of time, 10 to 14 days. We were able to meet so many needs with all the seasoned clinicians and staff that we had there. It was amazing.
I am a physician. 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 This changed the way I do my work. The way I think of work.
Changed the way. Because of this site, I learned that it is possible to end homelessness in a very reasonable and a measurable amount of time. How many people came through our site? Well, over 6,000, and they all received some type of shelter. So our site should be a model. We could have role modeled this site, set it up throughout Los Angeles County, done the same thing, and taken maybe 30, 40,000 people off the street. We can do it. We did it. I'm living proof. We did it.
I am a physician. I am a physician. This changed the way I work. I show the way I do my work. The way I think of work.
I am the way.
I am a physician. This changed the way I show up for work. The way I do my work. The way I think of work.
The way I think of work.
And what was
Change the way I show up for work.
I am a physician.
This changed the way I show up for work, the way I do my work, the way I think of work.
Thank you.
None of us had an experience with a pandemic. But I really like people, and I want them to be okay no matter what. You want a hamburger? Then I'm gonna bring it to you with all the trimmings. I've always cared about people. We made some relationships that just count. But some of those medical things, I didn't understand at all.
The social workers were best at de-escalating things in the building.
The social workers are the best in the escalating things.
The social workers,
Were best at de-escalating things.
they were best at de-escalating things.
In the building.
In the building.
They knew how to say it best.
One of the biggest things in de-escalating was to make sure patients knew I was listening. I'm listening to you, then you listen to me.
There was this one guy, he just recently got out of,
One guy,
One guy.
Some people would say, let's do it this way. And then others would say, let's do it that way.
Some of the staff would say, let's do it this way. And others would say, oh no, let's do it that way.
yes, let's do it this way. Another say, let's do it that way.
Let's do it this way. Let's do it that way.
And let's do it this way.
Okay, let's do it that way.
All the time.
I'm an African American for South Central. I just say I'm a part of South Central guy. I can speak street language better than the medical staff. So there were moments where they were calling the police, but I would calm it down. Hey man, this is not a memory you want. We don't want the police involved. So tell me what you need. Let me calm you down. There were times where I would go into their rooms when I should not have because they had COVID. But it made a difference.
there was this guy who recently just got out of prison.
One guy,
One guy.
This one guy,
Here's
one thing I learned from COVID.
If I were to tell you right now, you need to sit still for 14 seconds. Oh, you probably can't do it.
If I was to tell you, you had to stay perfectly still for 14 seconds. You'd say, it's impossible.
Because I'm messing with your head.
Messing with your head.
Messing with your head.
Now, you probably can do it. But the fact that I'm telling you, you got to do it, you gone.
it's okay. It's 10 seconds, but I need to move.
Oh,
You probably can do it.
you probably could do it.
It's 10 seconds. I need to move.
So, we are taking people who have lived their lives however they've lived their lives, and we are saying to them, you have to stay in this room for 14 days.
However they've lived their lives.
However, they live their lives.
You have to stay in this little room.
However they've lived their lives.
For 14 days.
For 14 days. Whew.
some people would just act out of order. And security or medical staff would get abrasive. But I would just talk to them. I remember when this one guy said, hey man, let me talk to you. And it was like 6 security guards. But I said, no, you guys leave. Let me deal with you.
Well, he's acting unruly.
He's totally out of line.
It's going on.
Like a volcano! Scary as shit.
It's dangerous.
That's okay. I don't think he'll beat me up. But just in case he does, maybe I deserved it. So I asked him, hey, what can I do for you?
Man,
I do want a pizza.
I would like a pizza.
I would devour a pizza.
I would eat it all up.
Make it disappear in the
Okay. I'm gonna get you a pizza myself. So I went and knocked on his door. Pizza delivery. And I said to myself, Jesus, please don't let me die because this is the COVID floor.
Ooh.
But it calmed him down.
Yeah.
That's de-escalating. You're making them sit and you're saying,
You could be dying, or you could not be.
Dying, that is.
you gotta think a little harder because you never know what's going on in people's heads. And it ain't their fault.
COVID.
Nobody invited COVID. It just showed up.
COVID. COVID.
Part 2. Post QI. Post pandemic. Now, as was said at the outset, Winston Churchill said, never let a good crisis go to waste. The good news is that the lessons invented by the QI staff, well, they are gaining traction. They are being embraced.
Collaboration.
No silos.
Passion. Harm reduction. Passion.
And compassion.
Building relationships, person to person.
Person to person.
These ideas are being embraced by Housing for Health, Safe Landing Sites, and the Skid Row Health Campus, and the call for extending these practices by creating similar sites in every neighborhood. But the only problem is, it's hard to be compassionate when the old existing systems aren't.
Yeah, it makes doing the right thing hard to do.
Now, when the systems were first created, they have now become more bureaucratic and removed. The bureaucracy created to solve the problem has become part of the problem. Now, it used to be that an outreach worker could get someone off the street and into a hotel. But now, everything must be done through a county-wide computer-based coordinated entry system, the CES.
What is the CES?
CES. Oh, it's the coordinated entry system.
Computerized emergency system.
Confusing, enigmatic system.
It is confabulating, excruciating stuff.
It's complicated, endless shenanigans.
Hey, wait a minute. The Los Angeles County Coordinated Entry System is the network that aligns homeless services in the county to ensure that resources are distributed efficiently and equitably to support people experiencing homelessness.
Thank you.
That's right. You know what? The CES is fair. That's what it is. Fair, rational, evidence-based. The neediest must rise to the top. Most for the most. We must prioritize the most.
In need.
We must find,
identify, and prioritize.
them.
Find, identify, prioritize. Find, identify, prioritize. Them.
Business as usual sucks. As usual, business as usual sucks.
Find, identify, prioritize.
Business as usual sucks.
Find, identify, prioritize.
As usual,
Them.
business as usual sucks. As usual, business as usual sucks.
Find, identify, prioritize. Find, identify, prioritize. Them.
Business as usual sucks. As usual, business as usual sucks. Business as usual sucks. As usual, business as usual sucks.
Calling 311. The couple in the car.
Hey, there is a couple living in the car in front of our apartment building. They need help.
Okay, how long have they been there?
About months.
Okay, you're gonna have to document how long, and then you're gonna have to sign an affidavit for each month.
Okay, they've been there since Thanksgiving, and it's May now. So that's November, December, January, February, March, April, May. I'll sign it.
No, you have to sign one for each month.
One for each month.
That is correct. Got to know that they're deserving.
Deserving.
They got to be chronically homeless.
Deserving to be chronically homeless? That's nuts.
Nuts, absolutely not. It is fair. That's what it is. Fair, rational, evidence-based. The most for the most.
We need to
We have to prioritize them.
the most in need.
Yes.
Yes.
Most.
We have to prioritize the most in need.
Most.
Okay, but what about the couple in the car?
Well, if they are most, no worries. If they're not most, they get nothing. Fair is fair, right? I mean, most for the most.
Most.
Okay,
Most for the most.
less for the lesser.
Yeah.
Now, correction.
Okay.
For the lesser, nothing.
Monday,
Nothing. Tuesday, nothing. Wednesday and Thursday, nothing. Friday for a change, once more, nothing. Saturday, Sunday, nothing.
I submitted all the forms. One for each month. One for each month.
Yeah.
Month. I gave them the location. An outreach worker came by sometime in the next week.
She didn't come by when they were sleeping, all night long, ankle swelling.
She didn't come by when they were sleeping.
They weren't in the car when the outreach worker came by. She left her card under the windshield wipers.
When the couple called to reach her, they couldn't reach her.
Full
Ah.
box.
They couldn't reach her because she was no longer herself.
What?
Changed identity.
Oh, come on, explain.
No longer an outreach worker.
What?
She quit her job.
Oh, frustrated, burn them all out.
She didn't come by at all.
Well, this got figured out over several weeks.
Long pause.
Take a little
break. Deep breath. Take a little break.
Several more weeks. And the new outreach worker came on.
He came on,
Yeah.
was hired, got out in the fields, came on. He came by when they were walking for hours on end from park to park. He came by when they were lined up at the shower, at the shelter, a mile away. With no appointment. He came by.
When he came by.
We know the director of that program, and he is passionate and doing good work. I wrote him an email, and he responded immediately. I told Mark, the man in the car, Mark, turn your cell phone on, keep it on.
The new outreach worker called, arranged an appointment, set a time at the car on Tuesday at 10:30 a.m.
He got them on a waiting list for temporary housing leading to housing.
Yeah.
They waited a week for her.
Uh-huh.
No, temporary housing. They waited a week for her and then a month for him. But, you know, the temporary housing, well, it's a decent functioning place. Everybody has their own space. Not a room, exactly. More like an open office situation with furniture defining your space. A bed, a chest, a desk, a trunk, and a locker. Furniture, not walls.
A decent functioning place. Social workers working to get them Section 8 vouchers.
Doing all the steps, all the steps, all the steps, all the steps. A year later, maybe 11 months later, they got the voucher.
Well, end of year 2.
2. Ooh.
They each found a landlord who accepted Section 8 and signed a lease. They each got an apartment and moved in.
Yeah. But hey,
What does this have to do with the COVID
hotel? Come on.
Oh, COVID hotel. Going forward is the safe landing sites,
Okay.
Skid Row Health Campus,
Nice.
advocacy efforts for accessible sites to be created in every neighborhood.
Yes.
Part 3. The micro is the macro. Oh, the former lobby of the Cecil Hotel with its 40-foot vaulted ceiling is now a safe landing site and home to 25 lazy boy chairs. Anyone in need of housing can just walk off the street and take a chair if one's available. Medical and social work staff will assess people and find temporary housing for them in a matter of days. Now, this is how we got Marvin into the safe landing created by Housing for Health at the Cecil Hotel. Marvin, after sleeping on the streets for 10 years, in the doorways on Broadway, Marvin is now in housing and applying for SSI. But, there was education to be done. Well, we had to intervene a number of times in order to get Marvin happy and willing to stay.
Oh, excuse me, ma'am. I was told that I could have a place to stay. All I had to do was show up.
All you have to do is show up.
Yeah, I was told by
A friend,
A neighbor.
A house person.
A normie.
Yeah, that I got a place to stay and had to stay, and all I had to do was show up.
All you have to do is show up.
All you had to do is show up.
No, not all I had to do was show up. All I had to do was show up.
Let me see your bag.
My bag? No, my bag.
Gotta see it.
My bag is everything.
gotta look through it.
Gotta have it.
I gotta hold the bag.
I gotta keep it.
My bag is everything. I'm fighting for this.
Oh, you get it back. As soon as you leave.
When I leave? Well, I'm leaving right now then.
Oh.
The micro is the macro.
Meaning?
Meaning, embrace the power of empathetic people.
Individual Angelinos.
Thousands.
Hundreds of thousands?
Millions.
The macro is the micro,
What?
meaning complex systems.
Alienate caring people.
They create a huge bureaucracy with just puny results.
Lots of hustle and bustle, but little for movement. Next to nothing.
Yeah.
January nothing, February nothing, March and April nothing, May and June along for nothing, July, August
July, August, nothing. July, August, nothing.
Lunes nada, martes nada, miércoles y jueves nada, viernes por cambio, poco más nada, sábado y domingo nada.
If there was a respite site in Mar Vista, I'd develop a relationship and get Max off the street. But with no place to take him to, it's ridiculous. It makes no sense.
So the micro is the macro.
Huh?
Yeah, the micro is the macro. What? The micro is the macro. The micro is the macro. So if we release the power of empathy in Los Angeles, we will mobilize thousands of local residents who care,
Nice.
but currently don't have an avenue to act.
Max, he's got a smile. He's got a big smile. He's got a big toothy smile. And multicolored clown pants. Hey man, how you doing?
Who wants to know?
Me do. I'm John. Who are you?
Max.
Hey Max, you know, I really like your look, man. I like your look.
Max is hanging out by the bus stop, the 33 at Venice Boulevard and Centinela. While Joaquin and Lucinda, well, they're selling hot dogs in the AutoZone parking lot right there.
Hola, hola. Tengo $20 para mi amigo Max.
Oh, hi. I have $20 for my friend Max.
¿Le puedes dar un perrito caliente con tocino cada día, por favor?
Can you give you a hot dog with bacon every day to him?
Yo regreso en 3 días con más dinero.
I'll be back in 3 more days with some money.
Más dinero.
More money. Sí, bueno. Matt es muy bueno, súper bueno. Nosotros le damos comida todos los días. Él nos tocó el corazón.
Max is good. He's super good.
Yeah.
And we give him something to eat every day because he touches our heart. Yo sé, yo te he visto darle comida cada día. Gracias a ustedes. Ustedes son muy amables.
I know, so you see your food every day to him. You guys are the best. You're so kind and nice. Thank you so much.
Yeah, man.
So with respite sites sprouting up like like hot dog stands, you'll be able to say,
Hey Max, you want to get off the street? Come on with me, my friend. Let's go. I'll take you right there.
I'll take you there.
Okay, take me there.
Yeah, Max.
We have seen failed policies.
Repeated Repeated.
We have seen failed policies. Repeat.
Repeatedly. Lee.
Street sweeps,
We repeat.
citations, warrants, and arrests.
Repeatedly. Lee.
Lock them up, release them. Lock them up, release them. And then we chase them down and we give them a one-way bus ticket out of town.
Greyhound therapy.
Yeah, well, guess what? You cannot police yourself out of homelessness.
Repeatedly repeated.
Repeatedly.
The only way out is housing and services and compassion. Release the empathetic power of the people of Los Angeles. By creating physical, medical respite sites to provide care for homeless folks in every neighborhood and community in Los Angeles, will release the empathetic power of the people of Los Angeles by the thousands.
Thousands of thousands.
Compassionate systems create compassion. And callous systems alienate everyone.
Every Angelino that knows 1, 2, or 5 people living in the neighborhood and living on the streets, every time you pass by,
Your stomach nods up.
We all let out a sigh.
If only I knew what to do.
with the respite sites in each neighborhood, you're gonna know exactly what to do, and you're gonna do it.
And you are going to do it. And you are going to do it. You are going to do it. And thousands upon thousands of people are going to do
That's
it.
right.
For each person that lives in the neighborhood, there's 10, 20, or 40 Angelinas. They wanted to help, but they never been able to figure it out how. But their daily acts is of kindness.
Yes.
A smile.
A conversation.
A piece of clothing.
$1,
$10, $100, $1,000, $100,000.
A million!
Bitcoin. Yeah.
With the create trust
they have
created, they had to bring the people in, and the only thing that's been missing
Yes.
is the place.
Yeah, a priest got me off the street. 10 years later, he had a place. He had a place.
I thought that was your story,
Wasn't it your story?
Lorraine.
You have a story like that, Lorraine, didn't you, when you were on the street?
Wait a minute. That's my story.
I know.
You see, I was homeless, sleeping in a doorway for 8 years. I got homeless because my first husband got on drugs, and I started using them too. And it took my mind. It was a nightmare. It took my children away from me. And I asked God to help me. And He did. He said, Sister Mary Murphy, October 6, 1994. And she sent me to a program. And they helped me. And I've been clean and sober for 30 years. And I'm happy to be clean and sober.
Yes.
I'm a miracle. And I help other people to be a miracle too. And that's a good thing.
With the medical resites in each neighborhood, guess what? y'all?
What?
We got the place.
The compassionate system is in place. The place is in place. The place is in place. The place is in place. Compassionate systems breed compassion. Callous systems alienate
Everyone.
compassionate systems breed compassion.
Okay, so we're going to set up right now for the panel, and stick around because it's going to be profound and moving.